A chokehold, choke, stranglehold, or, in Judo, shime-waza is a general term for a grappling hold that critically reduces or prevents either air or blood from passing through the neck of an opponent. The restriction may be of one or both and depends on the hold used and the reaction of the victim. The lack of blood or air often leads to unconsciousness or even death if the hold is maintained. Chokeholds are used in martial arts, combat sports, self-defense, law enforcement, and in military hand-to-hand combat applications. They are considered superior to brute force manual strangling, which generally requires a large disparity in physical strength to be effective, rather than using the fingers or arms to attempt to crush the neck. Chokeholds effectively use leverage such as figure-4 holds or collar holds that use the clothes to assist in the constriction. The terminology used varies. In most martial arts, the term chokehold or choke is used for all types of grappling holds that strangle. This can be misleading as most holds aim to strangle, not choke, with the exception of air chokes. In Judo terminology, blood chokes are referred to as strangleholds or strangles, while air chokes are called chokeholds or chokes. In forensics, the terms strangle and stranglehold designate any type of neck compression, while in law enforcement they are referred to as neck holds. Air choke. An air choke or tracheal choke specifically refers to a true choke that compresses the upper airway, hence interfering with breathing, and leading to asphyxia. Although less effective at inducing unconsciousness than its vascular counterpart, the air choke causes excruciating pain and air hunger, and in combat sports a fighter will usually submit to such a submission hold. Air chokes have been associated with fractures of the larynx, a hyoid bone, and are considered less safe than blood chokes to practice. The armbar choke is an air choke done by placing the forearm across the front of the neck from behind. The free hand grabs the wrist and pulls back the forearm, hence driving the forearm into the front of the neck. Blood choke. Blood chokes, carotid restraints or sleeper holds are a form of strangulation that compress one or both carotid arteries and/or the jugular veins without compressing the airway, hence causing cerebral ischemia and a temporary hypoxic condition in the brain. A well-applied blood choke may lead to unconsciousness in a matter of seconds. Compared to strangulation with the hands, properly applied blood chokes require little physical strength. Use in combat sports. Most chokeholds featured in combat sports and martial arts are blood chokes, although some air chokes or combinations occur as well. Blood chokes, especially the rear naked choke, triangle chokes, or gi chokes, are commonly used as submission holds in Brazilian Jiu-Jitsu. In Judo, chokeholds, known as shime-waza, are often subject to restrictions based on age or rank. Chokeholds are not allowed in sports sambo but are allowed in combat sambo. The chokeholds used in catch wrestling and shoot wrestling are the inspiration for the chokeholds in modern professional wrestling performances. Due to the effectiveness of chokeholds and the popularity in a wide variety of martial arts, they are most often used to force submissions in mixed martial art and submission grappling competitions. Use in law enforcement. In law enforcement, the goal is to force an uncooperative subject to submit without causing death or permanent injury. In this situation, it is vital to distinguish between air and blood chokes. A hold that simultaneously blocks both the left and right carotid arteries results in cerebral ischemia and loss of consciousness within seconds. If properly applied, the hold produces almost immediate cessation of resistance. However, to avoid injury, the hold cannot be maintained more than a few seconds. When pressure on the carotids is released, the flow of oxygenated blood resumes immediately and consciousness slowly returns. In contrast, if the airway rather than the carotid arteries is blocked, the subject cannot breathe, but his brain is still perfused with blood and he will remain conscious and may continue to struggle for a minute or more. He will lose consciousness only when the oxygen in the circulating blood is consumed and he collapses from hypoxia. Even if the hold is released at this point, the blood circulating through the brain contains no oxygen, and consequently the subject may not regain consciousness or resume spontaneous breathing. Possibly the most important element of training for the use of chokeholds in law enforcement is the understanding that the subject should always be able to breathe freely. In the illustration above, the operator correctly uses his right arm to compress both sides of the subject's neck, assisted by the pressure of his left hand, while his elbow, sharply flexed and centered over the midline, places no pressure on the trachea. Following a series of choking deaths, the Los Angeles Police Department banned chokeholds in 1980, and was soon followed by police departments nationwide. Choking suspects was widely banned by American police departments by the early 1990s, when New York City strengthened the force of an earlier ban on chokeholds. It is also forensically known as a carotid sleeper, lateral vascular neck restraint. In 1970, Kansas City, Missouri police started training officers to use a form of the chokehold called the LVNR, designed by the newly appointed Physical Training and Defense Tactics Supervisor, James W. Lindell. The main goal of the LVNR is not to render a person unconscious but to gain compliance of the subject and to cease the resistance. The LVNR is a control hold that restrains subjects by controlling the neck and limiting the movement, which at the highest levels of resistance may or may not render the subject unconscious. There are 3 levels of control based on the suspect's resistance level and allows the officer to de-escalate at any time. Once resistance ceases, compression is relaxed. Based on over 165,000 applications by the Kansas City, Missouri Police Department, 85% of subjects comply before being rendered unconscious. In addition to the unique aspects of the tactic itself, the LVNR also addresses training and post-application concerns. Training requirements for the LVNR are thorough and continuous. Types: anaconda choke, choke starting with attacker facing the opponent on all fours. Attacker passes his leading arm under the neck and outside past one of the opponent's arms while then grabbing his own other arm's free arm biceps. The attacker then arches his back, bending backward to apply the choke. Arm triangle choke, choke starting with the attacker facing the opponent. The attacker passes the arm over the opponent's same side shoulder and across the back to the other shoulder. The attacker then positions the opponent's arm across the neck and traps it using the head and applies pressure. May be performed from the top or the bottom. Das choke. The Das choke, also known as the Bravo choke, is similar to the anaconda choke, the main divergence being the choking arm is threaded under the near arm, in front of the opponent's neck, and on top of the far arm. Ezekiel Chokaso de Gurumajime, attacker grabs inside their own sleeve around opponent's neck. Gogo plata, performed from full guard by using an omoplata set up to trap the top man's arm, then pulling the bottom man's foot past the top man's head, pressing the shin of the leg against the throat. The bottom man then pulls on his opponent's head, cutting off the airflow and forcing him to submit or risk passing out from lack of oxygen. Guillotine, applied in front of and above the opponent. The attacker restricts airflow by lifting the forearm into the neck, a common finishing hold in mixed martial arts. North-south choke, applied from the north-south position with opponent facing up. uses the shoulder and biceps to cut off airflow. Push choke. This can be applied to a prone opponent, facing the person applying by simply placing a hand to the throat and pushing down. As the name implies, this is an air choke, and if left applied for too long, will result in fracture of the hyoid bone in the neck, and death. Because of the high likelihood of death to the opponent, it is often not used in most fighting, and is an outlawed hold within the wrestling community because of the high chance of it being misdelivered, resulting in death. Rear naked choke, applied from behind the opponent, starting by looping one arm around the neck so that the crook of the elbow is under the opponent's chin, then placing the hand of that arm on the opposite biceps. The other hand is then placed on the back of the opponent's head and pushes the opponent's head and neck forward into the crook of the flexed arm. Additional pressure may be applied by pinioning the opponent's lower body by locking the legs around the opponent's waist and arching the back to place more force against the neck. A simple and effective chokehold. It is the most common finishing hold in mixed martial arts competition. Triangle choke, applied from full guard. From mount, the opponent's neck is trapped in a triangle formed by their own arm and the attacker's thigh and calf. A common finishing hold in mixed martial arts. Peruvian necktie. The arms of the person applying the choke are laced around the neck with the opponent's bottom arm straight through the hole. The person applying then turns the opponent around and drapes his legs over the back, applying the pressure to the choke. Shin choke, used on a prone opponent by simply placing the shin across the neck, resulting in constriction of airflow to the lungs. It will quickly result in the loss of consciousness of the opponent. Short wrist choke. In Judo, the rear naked choke is known as hadakajime. Rear naked choke, one of the 36 constriction techniques of Kodokan Judo in the shime-waza list. It digs the blade of the wrist into the carotid sinus similar to the hand clasp method and uses a lever motion helped by the underhand. It is faster to apply, requiring less strength than the figure 4 mixed martial arts version, but is more difficult to learn. It is not an air choke but a carotid choke created entirely by the attacker arms. Von Flue choke. This choke is mostly used in MMA and some rare instances in wrestling. Because of the rarity of its use, it is often overlooked in its effectiveness. The choke is applied with the opponent in a supine position, with his back against the mat. The person applying then laces his closest arm around the back of the head, and places his entire body weight against the neck, causing both air constriction and restriction of blood flow to the brain. Prolonged applying of this hold can result in loss of consciousness, either due to loss of blood flow to the brain, or loss of air to the lungs. If kept applied for too long, it can result in death to the opponent.